My name is Yacoub, and I am the head of the Assisted Conception Unit and the Center for Pre-Implantation Genetic Diagnosis. As the lead consultant, I look after the whole unit, particularly when it comes to IVF. The lead person has a different name called the person responsible to make sure that the practices used in the unit are suitable, that the staffing are competent and caring and compassionate, that they know what they are doing, and that the team that I have are really capable of producing the best care ever in a nice, comfortable and safe environment. The unit here actually started back in 1991, and we were based at St. Thomas's initially. And over the years, the team has expanded, and we moved to Guy's Hospital into a smaller unit in 2002. But with the continuous expansion of the team and the activities, including treatment and research, we had to move to a purpose-built unit which occupies the whole of the 11th floor of Guy's Tower. And as you can see, it is a great team that we have from embryologists and scientists and nurses and doctors and administrators, in addition to our counselors. And this team now, you'll be talking about 60, 65 individuals, and they are all working in unison to make the journey of our patient as positive as it is practically possible. The strength of this unit that we really and truly are patient-centered. We have a dedicated team, and some members of our team, you would feel that they eat, drink, live, breathe in the unit, and they have their patients' interest in terms of their treatment, their investigation, giving the best advice at heart at all times. And because of this, we are well known for practicing only evidence-based medicine here, and we only do tests and offer treatment that adds value and make a difference to patients. We have been very successful over the years, and we are one of the most successful NHS units in the country when it comes to PGD, and when it comes to IVF, but when it comes to PGD, we are one of the most successful in Europe, and our services are used as a benchmark for services of this nature anywhere in Europe and perhaps in the world. I think it is important to make a distinction. We are one of the very successful. It will not surprise me if we were the most successful among the NHS IVF units. When it comes to the independent sector, it is really not helpful to go down the comparison and why it is valid or not valid, because the patient characteristic could be different, and the way the whole process is being handled may be different, so we can only compare like with like. And over the years, our success rate, despite adopting very safe and responsible practice by reducing multiple pregnancies which are associated with higher risk than single-term pregnancy, we have maintained a very good success rate that compares with the best in this country. We offer around 2,500 what we call licensed treatment cycle, and that includes IVF and ICSI, where the treatment is offered to couples whose infertility is due to sperm problems, where one sperm is injected into each individual eggs. We offer also intrauterine insemination treatment for couples whose infertility is unexplained, and we have judged this less invasive and less expensive treatment to be appropriate for them. We offer large number of frozen embryo transfer cycle, which one of our strengths, because our frozen embryo transfer program has been successful over the year, and we achieve the highest success rates with this. And the importance of this is just testify to how efficiently and productively we use the material that our patient produce. So it's not just a focus on fresh cycle. Any surplus material that is suitable for storage, we will be freezing for future use, even if it was just one single embryo. They there is a huge choice where to go for IVF. But if they choose us, they will have made the right choice, because they will come to a very big national health service institution with all the accountability, the clinical governance, the professional procedure that go with it. They will come to a place with high track records of safety, success, and cutting-edge research and innovation. They will come here where they will be treated by a dedicated team whose main aim is to provide the best medical care regardless of any commercial considerations. Of course, I am here all the time for my patients, and really doesn't matter whether they are NHS or they are coming privately. We try to cater for the needs of all kinds of patients, and as a lead consultant and person responsible here, we had to devise a special system for patients whose work pattern is not suited to coming during working hours here, and we have what we call personalized care, and patients can be seen as early as 7 o'clock in the morning or as late as 7:30 or 8 o'clock in the evening. And that is just to make the journey for them as seamless and as positive as possible without having to go to the stress of taking time off or having to cope with non-understanding or supportive boss, etc., etc. So we do not structure what we do around our convenience. We work around our patient's convenience. We do 7 days service. We do embryo transfer 7 days, and our services for egg collections are also orientated for patients' comfort and convenience. We have full anesthetic support where our procedures are done under deep sedation with a consultant anesthetist and anesthetic assistant in nice surrounding, and patient journey is generally positive, as most of our patients in feedback will give us excellent rating. I've been working in the IVF and the fertility since 1992, when I came to this country from Egypt, where I graduated, and I completed my doctorate degree in Birmingham University, and then I moved to Guy's and St. Thomas in '95, and I have been here since.